Being a kid with OCD is hard enough, but most kids with OCD also have intrusive thoughts, bad thoughts that get stuck in their head and they can't get rid of them. We're going to be talking about how to deal with those, so stay tuned. That's what's up next. Hi, I'm Natasha Daniels. I'm a child therapist and I make videos for kids who have anxiety and OCD. Today I want to talk to you about intrusive thoughts. So this is specific for kids with OCD because we all have bad thoughts, we all have anxious thoughts, but today I want to explain to you what obsessive thoughts are and what you do with them, because that's a big piece of the puzzle when you're trying to battle your OCD. So when you have OCD typically starts with an obsessive thought. Not like I'm so obsessed with Minecraft or I love my Instagram feed, not like that. But an obsessive thought is a thought that is not fun, not good, and it comes back over and over again. That typically is what drives OCD and drives you to do or avoid something, which we call compulsion. If you're like, what the heck is she talking about? You should watch my video on what OCD is. I'll leave a link below and it's right here because you need to understand OCD in general or you're not going to be able to battle this. So anyway, when you have an obsessive thought, a thought that's really upsetting, you're going to want to do or avoid something. But some people just have obsessive thoughts and they're not doing the compulsion, they're not doing something, they're not washing their hands or tapping or whatever you do to kind of feel a little bit of relief, but the obsessive thoughts are still there. So I often get that question in my practice. Kids who are making really good progress will say, Natasha, I'm doing really good. I'm not doing any of my compulsions. I'm not doing any of my rituals. I'm not doing anything that is going to grow my OCD. But I'm still miserable because I'm having these intrusive thoughts. So I want to talk to you about what you do with those. Intrusive thoughts could be anything, depending on your OCD theme. And so for you, an intrusive thought might be something that's really upsetting related to germs or your safety. And for another person, the intrusive thoughts could be about if they're a good person or a bad person. By the way, that's called moral OCD. And if you have it, you should watch this video because that will help you. But in general, today, we're going to just talk about what do you do with these thoughts? Because I tell kids, yeah, when you work on your OCD, it will get smaller, but the thoughts are still going to be there. It's what you're going to do with the thought that counts. So let's get into it. So I think it's important to say that yes, we all have intrusive thoughts. We all have really upsetting thoughts. And researchers will tell you this, that 90% of people have really upsetting, disturbing, weird thoughts, but they just filter it and they let it go. But I do feel like when you have OCD, not only are they more disturbing and more often and flooding you with thoughts nonstop, but I feel like OCD will find the thing that is the most upsetting to you, the thing that is the opposite of you, and will make you have those thoughts. And so they're going to be super upsetting because OCD is going to say, hey, you know what? She's really worried about this thing, so we're going to tell her this. Those are the kind of thoughts that you're going to have. They're not going to be fun, obviously, but they're going to be typically either the opposite of you. So if you are a really good person, it's going to tell you about how gross and disturbing and horrible you are. If you don't do anything bad, it's going to tell you that you do all these bad things. And if you're worried about germs or other stuff, it's going to tell you that like the whole world is just gross and contaminated. It's going to poke at whatever theme you have. A lot of times we're doing things that are ritualistic, we just don't realize it. So a lot of kids will do two things that they don't realize are still compulsions. And again, if you don't know what I'm talking about with compulsions, you need to go back and watch that other video. But so when you ask your parents for reassurance, you have a bad thought or an intrusive thought, you know, Mom, is this going to harm me? Or Mom, is this okay to eat? Or I did this, is that okay? Am I a bad person? When you do some reassurance checking with your parent, that is a compulsion and that is doing something to grow your OCD. And if you don't, you're like, oh, Natasha, I don't do that. I do nothing. There is mental checking. So the first thing that most people will do when they have an intrusive thought is argue with it. It's like, why am I having this thought? Whoa, that's a gross thought. That's a disturbing thought. That's a scary thought. Why am I having this thought? I don't want to have this thought. Let me try really hard to not have this thought. Okay, that's not going to work. You know why? The more you try to not have a thought, the more you're going to have it. Pink elephant. Ta-da! Tiger. Ta-da! When I say something to you, hey, whatever you do, don't think about a hot dog. Don't think about a hot dog. Don't think about a hot dog. Why are you thinking about a hot dog? You're gonna think about it. So when you have an upsetting thought and you're like, oh my gosh, I can't have this thought. Because if I have this thought, then it means that I am this. Or if I have this thought, then my anxiety is gonna grow. And I can't have my anxiety grow, so I can't have this thought. When we try not to have something, we have more of it. In my office, I have Chinese handcuffs. And those are, do you know what I'm talking about? Those are handcuffs, you put them in your fingers, and if you pull out, it tightens. And if you pull in, it loosens. And that is how we want to deal with intrusive thoughts. We do not want to fight it in the typical way. So I don't want you to argue with it. I don't want to hurt myself, so why is it telling me to do that? Or I don't want to think about that horrible image, so I have to get it out of my head. Everybody's thoughts are going to be different. So I might be using examples and you're like, what is she talking about? Everybody has different thoughts. But the point is, you don't want to try to physically or mentally force them out of your head. Instead, you want to acknowledge that it's OCD. I tell kids to acknowledge it. Yep, that's my OCD. Of course it's my OCD. I have OCD. OCD loves to give me really disturbing images and thoughts in my head. And that's it. It's junk mail. It's for the trash. And so people with OCD have a hard time doing that because they hold on to it. They rock it like it's a big baby and they grow it bigger until they have this huge baby of intrusive thoughts that they have fed and grown. You don't want that. Throw the baby out because you just want to accept it. And I know this is easier said than done, trust me. But you do want to accept it, acknowledge it, because if you acknowledge it, it's not going to be pinging at your door saying, pay attention to me, pay attention to me. I'm an intrusive thought. Why are you trying to ignore me? Hello, hello, hello. No, it's going to keep banging until you acknowledge it. So yeah, hello, I hear you, OCD. Thank you for that disturbing thought. Now I'm going to move on and I'm going to go do another activity that I enjoy. So this is very much like acceptance commitment therapy, ACT, if you've ever heard of it. And you probably haven't because you're a kid, but whatever. You just want to accept it. I think acknowledging it and moving on is, in a simple form, the best way to do it. I know that's really hard, and so it's easier said than done, but in a snapshot, that is what you want to do. Because the more you fight it, I can't have this thought, I can't have this thought. The more you argue with it, I'm not this, why would I have that thought? The bigger it will grow. When you accept it, yep, I have OCD. There's an OCD thought. Now you could take it one step further. Some kids can do this and some kids can't. But if you can make fun of it, even agree with it, that's awesome. So sometimes I will teach kids, especially kids who are more advanced in my therapy and have really progressed far, to make fun of it. So if your OCD is like, ew, you just touched that. There's so many germs in that, or whatever the intrusive thought is, you're like, yep, it's disgusting. It's all over my body. I'm spreading it everywhere. Or if it's like, oh, you want to do that bad thing. You're such a bad person. And you're like, yeah, I want to do that. I'm going to take it and I'm going to do it in such a bad way because I'm such a bad person. Now you have to have a good sense of humor to do that, and you also have to be able to not take the thoughts seriously. So that could be really tricky for some of you who are just starting to work on your OCD. But the more you laugh and make fun of it, the better. Now parents who are watching this, you really can't do that. Your child has to do that. And then you can go along with your kid, but sometimes kids can feel like you're laughing at them and not with them. And so you as the kid have to do this, and then it's okay for your mom or dad to chime in. So I know this is a super simple tip, But if you follow it, it can be very effective. So no arguing with your intrusive thought, no debating and saying, I'm not this, or why would I have that? You don't want to go down what I call the rabbit hole, because the longer you go down the rabbit hole, the bigger your OCD will grow and the more power it has, because it's sucking you in to a conversation in your head that it wants you to have. So acknowledge it, hello OCD, and then go do another activity. Don't just sit there and be like, that thought is still there. 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 No, just go on and do something else. Don't sit there and wait for it to attack you. Acknowledge it and move on. I know this is hard. It's really, the hard part is actually the doing part, not the idea of it. So hang in there. I hope that helps. Don't argue with it and move on. I hope to see you next week. There'll be a new video on anxiety or OCD. They come out every Thursday, so don't forget to hit subscribe. I'll talk to you later, and don't forget to find the sparkle in everything you do.